All right, now we're going to talk about renal calculi. What's another name for renal calculi? Kidney stones. Kidney stones. Have you ever heard the word kidney stone? This is due to some kind of abnormal crystallization of calcium buildup in the ureter in the renal system. So another name for this renal calculi we can say is the kidney stones. Again, most people, it's very common to patients that have certain types of diets. Kidney stones, okay? And so what do we say? It's a buildup of certain, let's put little quotes here so people know what's going on, what's the difference. It's the same thing, right? All right, so when we talk about kidney stones here, what is in kidney stones? Well, this is due to the abnormal blood calcium, magnesium, and also uric acid. So these molecules have a tendency of coming together, leading to an excessive crystallization. And if you remember from before when we looked at the kidneys, so if I draw my little kidney here, and you have the ureter, then you have the bladder, and then eventually you have the urethra, right? So if you go down to this structure that's been created, when we look at an actual kidney stones have a tendency of blocking in the ureter, in this ureter region. So if I label this the kidney, you have the ureter, you have the bladder, and then you have the urethra. All right, so there's these little renal calculi that are present, these little kidney stones that are created in the ureter, which cause problems, right? Why would they cause problems? Well, if you have this barrier or this kind of blockage, what happens? So kidney, as soon as it releases whatever fluid, what's that fluid called? That fluid is called urine. Whenever urine comes in and there's a blockage, a semi-blockage, there's a tendency, a lot of these urine molecules here that may go back up. So these urine can possibly go back up. And they can backflow into the kidneys. And if they backflow into the kidneys, you have all this high concentration of metabolic waste in your kidneys. So a lot of patients that have kidney disease have tendency of getting renal disease also. So they have a buildup of scar tissue in their renal system. So, for example, perfect example of this, like how do people have kidney stones? Is it based off of drinking a lot of milk, right? So like there can be some kind of congenital problems. Also, if you remember, perfect story, short story. Brother, me, when we were in our house, our parents never gave us any candy. We were sugar deprived children. We never really grew up the way most children did. We wanted like a Snicker or a Milky Way. We got a piece of cabbage and some spinach, right? And a carrot sometimes. That was our sweets once in a while. So one thing though our parents did was they brought us a lot of these vitamins. You remember those Flintstone vitamins? Everyone loved those, right? If you don't know what we're talking about, you're probably way too young to be watching this video. Anyway, so another candy that we had were these little chocolates. These specific little chocolates that we had were these calcium, right? I didn't like milk. My brother didn't like milk. So we had these little candies, these chocolate calcium candies. They had a high dose of calcium in these little pieces of chocolate. Me being the normal person and have some kind of sense of restraint, I would have one a day as prescribed on the box. Brother, on the other hand, had this big sweet tooth. He would, couldn't handle it. So what he would do, he would sometimes grab the box, take it all the way up to his room, and eat, 10, 20, 30 pieces of these little candies a day. Think about it. High concentration of calcium a day. And then me, being the person that I was, I told him, too much calcium isn't good for you. And he kept saying, well, it's going to make my bones really strong. I'll grow taller. That wasn't his real excuse. It was just a sweet tooth. So I told him, you might get kidney stones, jokingly, but I guess I jinxed it. And so he developed kidney stones. So he developed these little minor kidney stones because he had this excessive calcium. How did I know he was eating all the candies? From all the wrappers on his floor, because he never threw away his trash. Why would he throw away his trash? Mom would come and pick up everything. Anyway, so treatment for this. So a lot of doctors, when it gets to a point, depending on the size of the kidney stones, the treatment procedure is all relative. So usually if it's small, they usually have certain kinds of diuretics. What do diuretics do? So diuretics would inhibit antidiuretic hormone, which is responsible for water retention. So diuretics would cause you to urinate more, causing the possibility of flushing this this stone down into the bladder, eventually out the urethra, so you can just pee it out. Or they had this other procedure called lithotripsy. Lithotripsy is a procedure where they use sound waves to actually cause these further rattling of these molecules. So you have this boom, 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 boom movements happening in the ureter with this procedure called lithotripsy, and this eventually can break down the these calcium deposits, these calcium crystals, and eventually into smaller pieces where you can just urinate them out. So this is a perfect example of kidney stones. Another name for it, renal calculi.